Hello, my name is Max Meddert. I'm one of the glaucoma fellows at Washington University in St. Louis, and alongside Dr. Shebani, I'd like to present a case we'd like to call Yamane Tsunami. This patient had a history of spontaneous lens subluxation into the anterior chamber with the crystalline lens against the cornea, and so she underwent urgent lensectomy, anterior vitrectomy, and now we're looking at the Yamane lens insertion. As you can see here, the beginning of the Yamane is going very well. We have the leading haptic docked nicely in our 25 gauge needle, and the lens is in the proper orientation. After creating our bulb, our flange, we turn our attention to the trailing haptic, and during this portion we inadvertently flip the lens. If you look closely at the lens and don't pay attention to the docking, it's actually starting to tilt in a manner shown by this diagram. And we really get distracted because the haptic will not dock appropriately in advance further, so we try different positions, different techniques, but it becomes clear that the haptic has bent within the needle, and we need to trim that portion off before attempting a redock. On this next attempt, we are foiled once again, and the haptic springs right out and luckily lands in the angle, so we're able to re-grab it easily and this time thread it into the 25 gauge needle. You'll notice this really is the critical moment in the case. As the needle is withdrawn, we exaggerate the improper orientation of the CT Lucia lens, rendering it upside down completely, as shown by the diagram here. But we're so focused on the haptic that that's sort of set aside for the moment. But now that's stabilized and we need to reorient the lens. So using a Sinskey hook, try to flip it, but it's really not happening. It just keeps springing back. Try to couple this action with an intraocular grasper. Same thing, still struggling, really feeling the tensile strength of the haptics on the CT Lucia lens. And there's a concern as you're doing this, they could snap off at any moment. So it's a very tense maneuver. At this point, we go underneath the optic and try to flip it from a different way, coming from beneath, sort of exaggerating the improper positioning and then flipping. So we're pulling it up more anteriorly into the eye, exaggerating the incorrect positioning, and then completing that rotation as shown here. And you could feel it in your hands when it snapped into proper position. And on inspection, you could see that the lens is now oriented in the proper position, and the Yamane Tsunami has come to an end. Thank you for watching and appreciate your time. Have a good day.